Today in the studio, I'm joined by Alex Wallace and John Ray of Haven Home Health and Hospice. Gentlemen, thank you for being in the studio with me.
Thanks for having us, Mitch.
I have a question for you. What is one of the reasons that people feel like they are getting into hospice at the right time? I don't know when the right time is. Am I going too late? Am I going too early? How will someone know that it's the right time?
Yeah, so a lot of people have a long-term disease progression. Sometimes that disease progresses quickly, and sometimes it's stretched out, like with dementia and Alzheimer's. That disease progress can take years before it happens. A lot of times people wait too long, so their disease will progress really rapidly, and they're like, I don't know what to do, or I don't have the right amount of help in the house or home. And then that's usually the time where it's like, all right, I really need to call somebody, have someone come do an evaluation. For hospices, all you got to do is just give us a call, and then we can send someone out to do an evaluation. We can check their medical records, make sure everything is correct on like their disease progression, where they're at, and they make sure that they qualify for hospice. With us, we cover home care, home health, and hospice. So if they don't qualify for hospice quite yet, we can make sure that they get home health or home care, make sure the provided or the right resources are in the home until they're ready for that time, and then we can talk them through all the benefits with hospice.
So the key, of course, is independence. You want to stay in your house as long as you can. And that's, you guys help at the home in all sorts of different ways, correct?
Yeah, that is correct.
Yeah. So what kind of sources or what sort of resources do you provide in the home?
So when it comes to hospice, you get a social worker, a chaplain, and then you also get skilled nursing and a CNA. So CNAs can help with like bathing, nail, hair care, and any light housekeeping in the home, kind of keeping you comfortable. Your nurses are there for medication management and symptom management as you end the end of your life, basically. And then your social workers can help with any resources that you may need. Say the house is no longer safe or you can't provide the care you need in the house, we can help get you in a long-term care facility. And then chaplains are just there for counseling as well as just basic support for anything you need. Our chaplains also provide grief counseling 13 months after someone passes.
That's nice.
Yeah, a couple more little things is that we cover all pharmacy medicines that are related to the hospice diagnosis. We do all the DME, so if they need a hospital bed and oxygen or anything like that. And then there's a program, I guess, where we can provide respite. So if the caregiver's worn out and they need a break, we'll help pay for them to go into a skilled facility for a short time to give that caregiver a break.
John, you've been doing this a long time. What's like the major misconceptions of hospice care?
Yeah, I think people think of hospice as all bad in the sense that, and it is a sad time, but what I always tell people is that what hospice does a lot of times, it's a 6-month program, first of all. Like if somebody goes into it early enough, there's enough time to work with the families, and it focuses on the families as well. And so it can be very much a rewarding and beautiful thing too. And grieving and death and dying is a very hard topic for our society to talk about. We just don't like to talk about it. But it's not all bad, because that individual is going to pass away no matter what, but we help try to facilitate and make it as good of an experience as possible.
It's not an easy process, but it's an inevitable one, as you say. If someone wants more information, how would they get a hold of you?
They can call our main line. It's 417-581-1234, or contact us online at havenhome.us.
Well, gentlemen, thank you so much for being here. Thank you for serving the people here of the Ozarks.
Thank you.
Thank you, Mitch.